In the last video, I talked about some data dealing with whether masks have the potential to slow the spread of COVID-19. And the focus on that specific question was intentional, because that's the primary question underlying the recommendations or guidance or mandates or whatever for the use of masks out in public. The video prompted some good questions from several of you that I'll start to try to take a stab at here and maybe again in another later video. Let's start with whether masks protect the person wearing them from getting sick. This was usually asked in the context of this image that circulated a lot on social media lately. It's a box of masks with a disclaimer that they don't protect you from COVID-19. Now, first, when we ask scientific questions, precision is important. The difference might seem small, but whether masks offer protection to the person wearing them is quite different than whether masks can slow the spread of COVID-19, which we looked at in the last video. The effects on the wearer focuses on you, essentially what virus particles are you taking in. While the question of slowing transmission, that's focused on the broader population, more on the outward transmission from an infected person. So we'll look here at some of the data related to protection for the person wearing the mask. As we do, I'm going to try to be a little more transparent about my process for evaluating the data, as that aspect is almost always overlooked. And I thought maybe it would be helpful in case you want to do it yourself for this or other questions. So I started by searching a database of scientific papers. For example, I searched mask with an asterisk. That should cover either mask or masks, and disease risk. In this specific database, I got a little over 5,000 results. Obviously, that's a lot to go through. Now, databases like this often require a subscription, but Google Scholar works in a similar way. I actually use it a lot, and the same search at scholar.google.com returns even more results. Of course, some of the studies might be relevant to our question, and a lot won't. So where do you start? Well, one of the first things I'd do is look for a specific type of article called a review article. We often think about scientific articles that deal with a new study. They'll focus on the question that was asked, the methods the researchers used, and the results and interpretations of the results. But reviews are different. With these, a group of scientists will usually get together and decide to systematically review the literature on some question. The idea is to go back through all the relevant studies and consider them as a whole. It's important to remember that science doesn't generally work in absolutes or proofs, but instead it works in probabilities and weights of evidence. Each individual scientific study, assuming it's well done, can be thought of as informative and at the same time probably incomplete and to some degree imperfect. For a review article, the group of scientists will look at each study's conclusions in the context of the methods used to get the results, and also in the context of results from other similar studies. And if possible, they'll try to come up with some broad and robust conclusions that arise from a whole bunch of independent studies. If you hear about scientific consensus on some topic, this is likely one component of getting to that point. Here's just one review I looked at. It's from a few years ago, and the references for it and a few other relevant reviews are pinned in a comment if you want to have a look. In it, the authors consider several different aspects of data on masks and disease. For example, here's a table where they summarize some of the studies on masks and disease that were focused outside of healthcare settings. And there's a similar one for those within healthcare settings. Now, one really nice thing about review articles is that they assemble the most relevant studies in one place, making it easier for someone else, like me, to find things that are relevant. Certainly easier than browsing through the thousands of hits from my database searches. This review actually references 155 studies, and I'll just pick out one of those to highlight here. It's from 2013, and in it, the authors measured the amount of virus particles in the air in front of and behind different types of masks that were placed on a mannequin head that was attached to a pump that simulated breathing by the mannequin. Here's a figure from the study showing how it was set up. Influenza virus was stored in a liquid and sprayed toward the mannequin. Two tubes were attached to vacuum pumps to create some suction to sample the air around them, and the end of one of the tubes was placed in front of the mask, while the other tube was slipped through the mask with an airtight seal to sample the air behind the mask. They tested 8 different types or designs of surgical masks. Note, it's all surgical masks in this study. Respirators like N95 respirators, those weren't a part of these tests. But here's the main results figure they provide. For each mask type, labeled A through H here, there are 2 bars. The test was actually done for both influenza virus and separately for non-living inert particles, but we'll just focus on the influenza tests here. They're the gray bars. The bars represent what was called the reduction factor, which is simply the concentration of virus outside the mask divided by the concentration of virus inside the mask. So, if the mask had no effect and the concentration of virus was the same inside and outside the mask, the reduction factor should be around 1. If the mask is really good at filtering virus particles and the virus concentration outside is higher than what's inside, the value will get higher. They actually saw a pretty wide range of values for different surgical mask designs, and the differences might be somewhat understated since the y-axis here is not on a linear scale, but on a log scale. That means the distance between the bottom and first tick mark represents 10 units, while the same amount of distance between the first tick mark and the second actually represents 90 units. There's often good reason for doing this, but it's really important when you're interpreting a plot to consider it, as it can really change a conclusion you might draw. So, for example, for mask F, there was something like 50 times more virus outside than inside, while for mask E, there was less than 5 times more on the outside, suggesting quite a bit more got through. One important point is that at least some virus was sampled behind the mask in all tests. So, one takeaway might be that these 8 types of surgical masks, when worn correctly, filters some, but not all virus particles, with a wide range of effectiveness. Now, remember, this was one of 155 studies in the review article. Let's take a look at how it was used. The only place it's referenced is in a statement under a heading of non-randomized studies, where the review authors concluded that lower levels of evidence, this is for benefits of face masks, lower levels of evidence are available from cohort, case control, cross-sectional, laboratory experimental, and observational studies. If you notice, there's a superscript of 62 to 68 after the laboratory experimental part of the statement, and the study we just looked at is study number 65 in the reference list of the review. Bottom line, some studies have provided some evidence that masks might give some protection to the wearer, but the evidence is not overwhelmingly strong, and there are lots of important factors that include the type of mask, how it's worn, and how the virus or bacteria is transmitted. The lack of convincing evidence could be for a couple reasons. It's possible that surgical masks just don't provide that much protection. It's also possible that the lack of evidence is a reflection on the ability, or lack thereof, to set up a powerful and convincing study. For example, a great way to test whether masks offer protection might be to put a bunch of people in a room, randomly assign some of them to wear a mask and some not to, and then spray some infectious agents, say influenza or COVID-19, and see what proportion of the masked versus unmasked participants get sick. The problem with this is that it's a big no-no when it comes to ethics. You can't just subject people to an infectious disease as part of a study. That's off limits. So instead, as a scientist, you start to try to get creative, like hooking breathing pumps and tubes up to a mannequin and spraying the mannequin with a virus. Of course, that's a less direct test of what happens in the real world, and that's where the weight of evidence across many studies comes in. In the end, N95 and similar respirators probably provide the best protection for the wearer, which is why in cases of shortages, they're prioritized for healthcare workers and those at highest risk. And these are followed by things like surgical masks, which might provide some level of protection, especially when the disease is transmitted primarily through droplets instead of as an aerosol. There's even less data on cloth masks. They're probably more similar to the surgical masks, but exactly where they fall on the effectiveness scale, I don't think we really know. So finally, back to the box. Is this right? Well, it's probably an especially conservative statement, but generally, yeah. At best, the masks might offer some protection and might reduce your chances of getting sick to some degree, but the data certainly aren't there to suggest that surgical type masks will prevent illness with any high level of probability. Remember though, while that certainly might matter to you, it's really not the question behind the mask recommendations or policies, which again focus on virus going the other way, from infected people outward. Hope that maybe clarifies a few things for you. If so, feel free to spread the word by liking, sharing, or subscribing to this channel.